Good afternoon, everyone. My name is Sabrina Magallanes. Thank you for the opportunity to present this background briefing on community-based supportive services for individuals experiencing homelessness who also have disabilities. As Los Angeles continues to face a growing homelessness crisis, it is essential that our response not only increase access to housing, but also ensure that individuals receive the community supports they need to live safely and independently. Today, I will discuss the challenges facing this population, review key disability laws and assistive technology policy that guide service delivery, and provide recommendations for improving community based services while maintaining compliance with federal disability law. Individuals experiencing homelessness often have complex needs that extend beyond simply obtaining housing. Many have physical disabilities, intellectual or developmental disabilities, mental health conditions, traumatic brain injuries, or chronic medical conditions that require ongoing support. Without access to coordinated community-based services, many individuals rely on emergency rooms, psychiatric hospitals, or interactions with law enforcement to meet basic needs. This cycle is both costly and ineffective. Our goal should be to create systems that provide preventative services, improve health outcomes, and support long-term community integration rather than crisis intervention. Challenges. There are several barriers that prevent individuals with disabilities from successfully accessing community services. Transportation remains one of the largest obstacles, making it difficult to attend medical appointments or receive ongoing treatment. Many shelters and community facilities are not fully accessible or lack accommodations for individuals with mobility, sensory, or communication disabilities. Another challenge is the lack of coordination between healthcare providers, housing agencies, social service organizations, and disability service providers. Limited access to assistive technology and the digital divide also make it difficult for individuals to communicate with providers, apply for benefits, or participate in telehealth services. These barriers contribute to increased homelessness and unnecessary institutionalization. Americans with Disabilities Act. One of the most important laws guiding disability services is the Americans with Disabilities Act, or ADA. The ADA prohibits discrimination against individuals with disabilities and requires state and local government to provide equal access to public services, programs, and facilities. For Los Angeles, this means that homeless shelters, community service agencies, transportation systems, and communication methods must all be accessible. Reasonable accommodations may include wheelchair accessible facilities, sign language interpreters, accessible websites, or alternative communication methods. Compliance with the ADA is not optional. It is a legal obligation that ensures individuals with disabilities have equal opportunities to access services and participate fully in their communities. Olmsted versus LC. The 1999 Supreme Court decision, Olmsted versus LC, significantly changed disability policy by establishing what is known as the integration mandate. The court ruled that unnecessary institutionalization of individuals with disabilities is a form of discrimination under the ADA. Instead, individuals have the right to receive services in most integrated community settings appropriate to their needs. For our community, this means expanding supportive housing and community-based services rather than relying on hospitals, psychiatric facilities, or correctional institutions. Investing in community supports not only fulfills legal obligation, but also improves quality of life and often reduces long-term public costs. Assistive Technology Act of 2004. Assistive Technology Act of 2004 is an important federal policy that supports access to assistive technology devices and services for individuals with disabilities. The Act funds state assistive technology programs that provide device demonstrations, equipment loans, training, financial assistance, and device refuse programs. reuse programs. Assistive technology includes much more than wheelchairs. It also includes communication devices, medication reminder systems, cognitive support applications, adaptive computer technology, and environmental controls. For individuals experiencing homelessness, access to assistive technology can improve communication with service providers, support medication adherence, increase independence, and reduce reliance on emergency services. Incorporating assistive technology into community-based services aligns with the goals of independent living and person-centered care. Assistive technology supports community living. Assistive technology can address many of the barriers individuals with disabilities face experiencing homelessness. Augmentative and alternative communication devices help individuals communicate with healthcare providers and case managers. Smartphone applications can provide medication reminders, appointment alerts, and navigation assistance. Mobility devices promote safe transportation within the community, while platforms improve access to healthcare and behavioral health services. Environmental control technologies can support individuals once they transition into permanent supportive housing. Rather than viewing assistive technology as an optional service, it should be considered as an essential competent component of comprehensive community-based supports because it promotes independence, safety, and community participation. Proposed solutions. Based on the challenges discussed, I recommend several strategies for the City of Los Angeles. First, continue expanding supportive housing that incorporates universal design practices to ensure accessibility from the beginning. Second, increase funding for assistive technology assessments so individuals receive devices that meet their specific needs. Third, establish interdisciplinary outreach teams that include healthcare professionals, social workers, assistive technology specialists, and mental health care providers. Additionally, stronger partnerships among regional centers, LAHSA, healthcare organizations, HUD-funded programs, and community nonprofits can improve coordination and reduce duplication of services. Finally, increasing transportation options and expanding telehealth services will help individuals remain connected to ongoing care and reduce unnecessary emergency service utilization. Expected outcomes. Implementing these recommendations would produce positive outcomes for both individual and communities. Individuals would experience greater housing stability, improved health, increased independence, and better access to services. At the community level, we would like to see reductions in emergency room visits, psychiatric hospitalizations, incarcerations, and healthcare costs. Community-based services are generally less expensive than institutional care while also providing better long-term outcomes. Most importantly, these recommendations support the civil rights of individuals with disabilities by promoting inclusion, dignity, and equal access to opportunities. These recommendations are supported by the federal disability laws and policies, including Americans with Disabilities Act, Olmsted versus LC, and Assistive Technology Act of 2004. Additional guidance was drawn from the ADA Standards for Accessible Design, HUD Disability Resources, and data from the Los Angeles Homeless Service Authority. Together, these laws and policies provide a legal framework for developing accessible, person-centered community services that promote independent living and improve community for individuals experiencing homelessness with disabilities. Thank you so much for listening.